Hello and welcome to this podcast. This is a special episode about gestational diabetes. My name is Danielle Hugo and I'm here today with Bianca Walker. And we are medical students of the University of Cape Town, currently in our fourth year of study. We have a very special guest with us today, Mr. Jason Marcus, and we feel very honoured to have him with us here today to help us learn a little bit more about gestational diabetes. Not only is he a specialized midwife, but also has a master's in health sciences education. So he has lots of experience in maternity and is also a great teacher. Welcome.
Hello.
Thank you.
Okay, so we just want to get a better understanding of what gestational diabetes is. So from our understanding, it's very similar to other types of diabetes in that it affects how your body processes sugar. So the word gestation is used as it means pregnancy, showing that this type of diabetes happens only during pregnancy. So what happens is when you eat, your body produces insulin, and insulin is the hormone that helps sugar move from the blood into the cells, and this is how our body gets energy. So diabetes is what happens when the insulin either isn't being produced or isn't working properly, and sugar basically piles up in the blood. We think the reason why it happens during pregnancy is that the placenta, which is the organ connecting your baby to your blood supply, is producing hormones that interferes with insulin. Do we have this about right?
You're absolutely correct, Bianca. And it is a very important contributor to more deaths and illness around pregnancy for both baby and mothers. So it's important that we screen for it early in the pregnancy and get on top of it as soon as we can. To prevent the complications, which I'm sure we'll talk about in a few minutes.
Yes, okay. So our main focus of the podcast is basically talking about the types of treatment that we can use for gestational diabetes. So in normal diabetes, the sort of main focus is on lifestyle changes, exercise, and promoting a healthy diet. But to focus on the medication, how do you experience in Cape Town specifically, how do they treat gestational diabetes?
Generally, we use a tablet called metformin,
Okay.
Which is also used in people who are not pregnant in managing their diabetes. So that's usually your late onset diabetes. This is usually for the duration of the pregnancy. And when the woman goes into labor, we would then use insulin via an infusion that delivers a constant dose of insulin while she's in labor in order to normalize the blood sugars during the labor.
Okay, and would you ever need to use insulin before she's in labor, like if the diabetes is so uncontrolled?
If it becomes uncontrolled, or if she has been insulin dependent before the pregnancy, she will just continue with the insulin.
We've heard of women with gestational diabetes, sometimes they take medication, or people with diabetes in general, they take medication and then they'll end up getting very faint and weak and collapsing and those sort of things, and then having to go into hospital. What's the reason for this?
Well, it depends on the timing of the medication, and when you're on anti-diabetic medication, it's important that you actually do eat properly, and because this fainting and feeling listless might be associated with them not eating adequately. And now you're taking a medication that reduces your blood sugar levels, and if you don't eat, you're not putting fuel into the machine, and the machine is going to stop.
Yeah.
Okay, so it's got to do with how the medication works and the fact that it helps you to produce insulin, and then if that isn't there, then you'll end up with low blood sugar.
There we go.
Okay,
that's generally, and one of the common side effects of people starting on metformin is diarrhea, actually.
Okay.
But that takes up to 3 to 4 weeks to kind of sort itself out.
Okay.
And if there is diarrhea, one can treat that with other medications. Again, it's important that you speak to your health provider about these side effects, so that they can try and assist with managing it or minimizing it. Because a lot of these medications take some time for the body to become accustomed to it, and over time it gets better. But it's important to stay on top of side effects, because it can cause a woman to stop taking the medication.
Yes.
Because the side effects are so bad.
Okay, so just speak to the doctor and get advice on how to deal with it.
Depending on what the side effects are.
Okay.
And if they don't take their medication regularly and their blood glucose isn't well controlled, is there anything that can happen to the baby if there's too much
things
sugar?
that can happen to the mom and the baby. So women who have diabetes during pregnancy, they also run, and like with people who are not pregnant, run the risk of developing other complications such as high blood pressure, because diabetes by nature is what affects your blood vessels as well over time. So it can worsen the condition. It can cause kidney damage in the mom, and that's what we're trying to stop.
Prevent, yeah.
And then in terms of the baby, if the mother has high sugar levels constantly, the babies tend to pack on more and more weight. So they tend to be a bit bigger, and that in itself can cause problems during the labor, and it might cause an obstruction in the birth because of the size of the baby. And then we also know that at certain times during the pregnancy, women who have uncontrolled diabetes have a higher risk of having stillborn babies because of the effects of those high sugar levels.
Okay.
And then for the baby after birth, because it was in an environment where it had high sugar all the time, so after the baby's born, they don't have access to that high sugar levels, and they run a risk of dropping their sugar levels, and that in itself can cause problems with the baby, like stopping in breathing, stopping the heart, etc. So they become quite sick after birth.
But presumably in the hospital they'll look after the baby really closely after it's born.
So what happens is the baby usually gets admitted to the newborn unit. They're quite big, these babies, in excess of 4 kilograms, and their blood sugars are monitored every 2 hours. They make sure that they get fed frequently, breast milk obviously, and just for up to 24 hours, 12 to 24 hours, we see what they do with their blood sugars.
But of course we want to try and control the diabetes so it doesn't get to that point. So is there any way that women have to take metformin? You mentioned it's a tablet. Do they take it?
It depends. It might be a twice daily dose, or it might be once a day, depending on the levels. And it's usually associated with meal times. Similarly with insulin, because you can't take insulin and not eat within the next half an hour or so.
Okay.
The blood sugar will drop it, you might pass out.
When's the best time to take it? Before meals or
usually
with
after
meals? Okay.
Or maybe with or after, so that you minimize the nausea effect. Because if you take some of these medications on an empty stomach, it can just worsen the nausea side effect.
Okay, so with meals or after meals.
Okay.
Yeah.
And we spoke a little bit about speaking to a doctor if we're experiencing side effects or if mums are experiencing side effects. In terms of anything else that prevents mums from taking medication, forgetting, or maybe just not feeling like dealing with things, do you have any advice for people that have difficulty with taking medication?
Yeah, I think it's probably the starting point should be understanding the condition well, and how it is managed, and how important certain treatments are in managing the condition. And in my experience, it's usually people that have good insight into conditions would tend to do what is necessary in order to control it. For those who are forgetful, it's to associate certain habits with the medication. So if you brush your teeth, most people do it at least once a day. So associate it with that activity, because that's something you do all the time.
Yeah.
So leave some where you brush your teeth, and you'll be reminded of that. And also similarly in the evenings, if you have to take an evening dose of it, then
when you brush your teeth, for example. Yeah.
That's it. And during the day, put an alarm on your phone. Make sure you carry your meds with you. And most people have smartphones that you can actually put multiple alarms on, and to remind you to take your medication. Tell somebody else, like a family member.
Yes. Okay.
Like your partner, other children, if you have them, and make it a family affair.
Yeah, so support is also quite important in adhering to medication. And then just to go back a bit to the medication, is there any specific way that insulin and metformin have to be stored? Like, does it have to be in the fridge, or does it have to be like in a cupboard or anything like that?
Yeah, so like most medications, you want to store it in a cool, dry place. Insulin should ideally be kept in a fridge. Okay. And if you're going to travel with it, make sure you keep it in a cooler bag or cooler box. because heat will destroy how well it works.
Okay.
And in terms of insulin, irrespective of what type you're on, you shouldn't use it more than 28 days after first starting a vial.
Okay. Okay, so must you throw it away after 28 days? Okay. And is there, I know we've kind of spoken about the sort of things to look out for if you don't take your medication, or if maybe you take too much of it. Is there anything specific that like patients or the woman should look out for when taking the medication? Any sort of warning signs to indicate that maybe they've taken too much or they're not taking enough or anything like that?
Well, it all depends on the it's dose dependent on what you do. So if you take too much insulin, you're going to pass out, because it will cause your blood sugar levels in your body to drop very rapidly. So you're feeling faint and then just collapsing, because your body doesn't have fuel with which to work. If it's too little, your blood sugar levels will then be too high. So if you're not getting on top of high sugar levels, then your dosages may need to be adjusted, or you might have to be taken off metformin and put onto insulin.
Okay.
If you can't get control of high blood sugars.
Okay.
Okay, so I think we have a little bit of time to look at some questions that we got from pregnant moms before recording this. Mm-hmm. By far the most common question is what will happen when the baby's born, and you've spoken a little bit about monitoring the baby, but what will happen to the mom, and will the diabetes go away? Should she be worried in future pregnancies?
Okay, so women who develop gestational diabetes or diabetes in pregnancy are at risk of developing type 2 diabetes later in life, and we think about 3% of women who have it will develop it within 5 years after the pregnancy. Okay. So what we tend to do is at the 6 weeks postnatal visit, another glucose tolerance test is done to see what her body does. Okay. If that is normal, she's clear for the time being. Okay. And then she just needs to make sure that she has annual follow-ups with her care provider to just make sure that type 2 diabetes is not setting in.
So do you think that it's likely that they'll have diabetes again in pregnancy if they've had it previously before?
That is one of the risk factors. So if you've had it in this pregnancy, chances are it's probably going to recur in the next pregnancy. So with subsequent pregnancies, it's always a good idea to seek care before you become pregnant, so that you make sure that your body is in the optimum state to conceive and to carry on with the pregnancy. Okay, so pre-pregnancy care, and then normalize the blood sugars if you are diabetic, and then become pregnant and just stay on top of it, because it is manageable.
And finally, we just wanted to ask if there's any like pertinent advice or like something like really important that you would advise mothers that have gestational diabetes, something that you think is to you the most important thing.
Know your numbers, know your readings, know what you're on, you know how it works, etc. Become familiar with what you're living with.
Well, hopefully this podcast helped a little bit in providing women with some knowledge about gestational diabetes. I think we're going to round off here.
We'd just like to say a big thank you to Mr. Jason Marcus for his time.
Thank you very much, ladies.
Thank you very much for listening to our podcast. If you have any questions, please comment below and we'll get back to you as soon as possible. If you require any additional information, you can check out the resources below.